name is Caroline, founder of Equitopia. In our exploration into the biomechanics of horse and rider and the factors that influence the various outcomes, in this video we talk briefly about bridles. We reached out to William Micklem, inventor of the Micklem Bridle, and Dr. Monica Aleman of UC Davis in order to delve deeper into the impact of the design of headwear in relation to the horse's facial anatomy.
I always remember these lines from childhood. This oss wasn't born to tread the earth. He took natural to the air, and every time he went aloft, he tried to leave me there. It always brings a smile to my face, and the stories of wild, difficult horses are numerous, and the stories of the great bravery and skill of people who were prepared to ride these horses and dominate these horses are also numerous. It's not true to say that most horses are wild. Most horses are compliant. Most horses are very willing to work with human beings. And there is a reason why so many horses are badly behaved, and that is because they're in discomfort or in pain. And the most common cause of pain and discomfort is in their headwear, in their bridles, in their nosebands, and in their bits. And it's also because there is this philosophy that we need our horses to submit. We need to have submission, when I would use the word acceptance instead. It's important to look at the skull of the horse. The first area which I think more people know about is the sensitivities at the poll, or the top of the head. This is very close to the brain. This is where all of the nerves originate.
The poll could be sensitive because there are nerves innervating all the skin in the horse, especially on the back of the head. And there's also the attachment of the nuchal ligament into the nuchal crest. And if there's a lot of pressure in that area, it could be a source of pain, because again, it puts pressure into the attachment and into the bone.
Now, it is possible just with a pen to put pressure on the top of a horse's head and make it move the head and neck dramatically down, or even lie down. You have one of the branches of the trigeminal nerve, you have the facial nerves, and you have the glossopharyngeal nerve, which are all having an effect.
There are certain nerves that we need to be just careful. For example, one of them is the facial nerve and also the trigeminal nerve, because those can tend to go more superficial through the skin. So if there's a lot of pressure in certain areas, could certainly be a source of pain. If inappropriate bridle, certainly can cause pain.
If you are thinking of making your horse comfortable, you have to avoid putting extra pressure on these nerves. Something totally fascinating. As I put my fingers down there, you can see that the top jaw is wider than the bottom jaw. But you don't really notice this until you separate the top jaw and the bottom jaw, and you can see the considerable difference in the width of the two jaws. This is the horse designed for eating in this fashion. What this means is we then strap a noseband on here, and worst of all, some people put it very tightly there, and the sensitive tissue on the inside of the mouth is squashed between the noseband on the outside and the protruding molar teeth on the inside, which is why many people rasp the teeth and rasp the teeth and rasp the teeth. But even with rasping the teeth, you will find that you will still cause problems with the cheeks on the inside. Cranked up nosebands in the normal position are extremely uncomfortable for a horse. You have these two holes either side. Out of these two holes comes the infraorbital nerve.
And that infraorbital nerve has very important functions, sensory to the face and especially to all the area of the muscle.
So when you put pressure, which you are doing with the cranked up noseband, on the nerve, because it's acting directly onto the bone, over a period of time you are numbing this area of the face, because constant pressure on a nerve will cause numbness.
So it may cause numbness, or it may cause pain, and it could even go far to produce lack of sensation on that part of the nerve if it's a severe pressure.
And then we go to the nasal bones. Now this horse actually is a quarter horse and has extra short nasal bones. They're normally a little longer, but you can see how fragile they are. Now in my opinion, low drop nosebands should be banned because they're operating on this area here or even a little bit lower. And when I first started out on this journey of trying to make a horse more comfortable, I became aware that so many skulls have fractures in this area here. So there is a tendency to have these drop nose bands that are very low, and again I think that they're just cruel. I wanted you to take a close look at the bars of the mouth, and you can see that they are rather like a knife edge. The tongue sits on top of the bars of the mouth, and then the bit sits on top of the tongue. So people talk a lot about the pressure on the tongue from the bit, from the front, but what they should be concerned on is underneath the tongue are the bars of the mouth. And as you put pressure on the tongue because of the bit, and the tongue squashes down on these sharp bits here, the horse gets uncomfortable, so they start lifting the tongue or even get the tongue over the bit. And of course, once they get the tongue over the bit, they're even more uncomfortable because the little delicate tissue on top of the bars of the mouth gets damaged. This is why the most popular bit in the world is a 3-ring snaffle, which is a type of gag which is trying to lift the bit up. But as you lift the bit up, what you do, but you throw the bit into the first molar on the bottom jaw and the upper jaw. And you again can make the horse very uncomfortable because of that. So overcoming the 5 main areas of discomfort or pain. 1 shaped and widened headpiece with no narrow noseband strap going underneath it. So it's just a single unit. And then very important, as we come here, it stays narrow. Now a number of people are making widened headpieces here, but all they're doing is forcing the bridle forwards and pushing it into the horse's ears. Number 2, there is no pressure on the molar teeth. I can, with 1 finger either side, you can just move the bridle out. So there's no inward pressure and no problem with the protruding molar teeth here. As regards the infraorbital nerve, you can see that we again are avoiding that area. And once again, we can move the bridle out, there's no inward pressure there. As regards the sensitive nose bones, the front of the nose fits above the sensitive nose bones, so it's well clear. You have the cavesson noseband or flash noseband in that typical position. There you have the Micklem bridle, and there you have the low drop noseband, or sadly, very often they make it even lower than that, and you can see how it's right down to the end of the nasal bones. The bridle sits behind the protruding cheekbone here, the zygomatic ridge. And then, as regards the bars of the horse's mouth, you can see here that I have a clip connection from the bit to the ring here, which means that with young horses, I always put this on, or with riders that are novice riders. So if they over pull at the horse's mouth, or if the horse throws its head and neck up when you're lunging and you have side reins on, for example, the pull goes direct from the bit to the front of the noseband rather than on the bars of the mouth. So it protects the bars of the mouth.
In light of the sensitivity of the facial nerves and bones, it is important that all headwear be adjusted for the comfort and welfare of the horse. At Equitopia, we use the taper gauge researched and designed by the International Society for Equitation Science.
It's all about a different mindset. Traditions can be changed, that horses can be treated more humanely, that change can be made based on a better understanding of the anatomy and physiology of the horse. If it can be done with bridles, it can be done in many other areas. As American author David Foster Wallace said, good education teaches us to be a little less arrogant, to realize that much of what we think is certain is in fact wrong and deluded, to critique ourselves and not just the world around us. The key is to stay humble, to keep questioning, and to keep studying our subject, because we must not be afraid of change.